Mental health crisis in America as people are in deep trouble. Are you feeling overwhelmed and struggling to cope with the stress of everyday life? You're not alone. Mental health crisis is on the rise in America, with more and more people falling into deep trouble. Hello guys, and welcome back to the channel. In this video, we'll delve into the causes of this crisis, the impact it's having on our society, and what we can do to help ourselves and those around us. So, if you're ready to face this important issue head-on, hit play and let's start the conversation about the mental health crisis in America. There is frightening data that illustrate that mental health is a major concern in the United States. When we consider that the Centers for Disease Control and Prevention estimates that 1 in every 5 individuals has at least one mental health disorder each year, it's difficult to dispute that we need to prioritize mental health awareness. Unfortunately, there is also a significant stigma attached to anything related to mental health, which is why it is critical that we recognize good mental health efforts and work to overcome the barriers that have been erected that prevent us from addressing mental health in a positive, productive manner. You should give yourself permission to tune into yourself and assess your overall mental health on a frequent basis so that you can effectively address your requirements. Mental health awareness is one of the most serious challenges in the healthcare profession as a whole, which is why there is a nationwide effort to celebrate mental health awareness every May, fighting stigma, offering support and services to those in need and their loved ones, and lobbying for legislative changes are all important aspects of Mental Health Awareness Month. Your mental health has a significant impact on your overall well-being. Being in a positive mental state may help you stay healthy and avoid significant health problems. According to one research, improved psychological well-being may lower the risk of heart attacks and strokes. Poor mental health, on the other side, may lead to poor physical health or dangerous habits. Chronic illnesses. Many chronic conditions have been related to depression. Diabetes, asthma, cancer, cardiovascular disease, and arthritis are examples of these diseases. Schizophrenia has also been related to an increased risk of cardiovascular and respiratory disorders. Dealing with a chronic disease may be made more difficult by mental health issues. People with depression or other mental health issues have a higher death risk from cancer and heart disease. People suffering from mental illnesses are more prone to suffer from sleep problems such as insomnia or sleep apnea. Insomnia may make it difficult to fall or remain asleep. Sleep apnea causes breathing issues, which may cause frequent awakenings. Sleeping disorders affect around 50% to 80% of adults with mental health concerns. Sleeping issues affect just 10% to 18% of the total population, while disorders such as depression, anxiety, or bipolar disorder may cause sleep difficulties. Sleep problems can also exacerbate pre-existing mental health issues. People with mental illnesses are more prone to smoke than those who do not have mental illnesses. People with mental health issues are more likely to smoke more cigarettes than non-smokers. Depression patients have reduced amounts of the neurotransmitter dopamine. In your brain, dopamine impacts good sensations. Because nicotine in cigarettes causes the neurotransmitter dopamine to be produced, smoking may be used to alleviate depressive symptoms. However, since nicotine only provides brief comfort, you may develop a recurrent craving to smoke, which might lead to addiction. People suffering from mental illnesses are less likely to have access to competent health treatment. It may also be more challenging for persons suffering from mental illnesses to maintain their physical health. It might be difficult to seek treatment, take medicines on a regular basis, or get adequate exercise when you have a mental health problem. The majority of suicides are caused by a diagnosable mental condition, most typically a depressive disorder or a drug misuse problem, as men commit suicide at 4 times the rate of women. Women, on the other hand, attempt suicide at a higher rate than males. Caucasian males over the age of 85 had the highest suicide rates in the United States. Suicide, on the other hand, is one of the major causes of mortality among teenagers and adults aged 15 to 24. Schizophrenia affects around 1% of all Americans. In most instances, males develop schizophrenia in their late teens or early 20s. Women are more likely than males to develop schizophrenia in their 20s or early 30s. Around 18% of adults aged 18 to 54 have an anxiety problem. Panic disorder, obsessive-compulsive disorder, post-traumatic stress disorder, generalized anxiety disorder, and phobias such as social phobia, agoraphobia, and particular phobia are examples of anxiety disorders. According to a recent Pew Research Center study of survey answers from the same Americans throughout time, at least 4 in 10, 41%, had suffered significant levels of psychological distress at least once since the early phases of the coronavirus pandemic. Young individuals are more vulnerable to severe psychological suffering. Across 4 center surveys performed between March 2020 and September 2022, the majority of persons aged 18 to 29 reported significant levels of psychological discomfort at least once. The study emphasizes the fluid nature of psychological discomfort among Americans, as evaluated by a 5-item score that asks about feelings like loneliness, worry, and difficulty sleeping. In the September 2022 poll, 21% of U.S. adults were classified as having high psychological distress. In each of the previous 4 surveys, no more than 24% of persons were classified as having severe psychological distress. However, since people's degrees of anguish change over time, a much bigger number of Americans, 41%, had experienced high psychological distress at least once in the 4 polls performed during the last 2.5 years. In addition to age, severe psychological discomfort is highly associated with handicap status and income. Across the 4 polls, over 2/3, 66% of individuals with a disability or health condition that prevents them from fully engaging in job, school, housekeeping, or other activities experienced a high degree of discomfort at least once. And individuals with lower family incomes, 53%, are more likely to have suffered high psychological distress at least once since March 2020 than those with middle, 38%, or high-income families, 30%. While many Americans had mental health issues prior to the coronavirus pandemic, public health professionals cautioned in early 2020 that the epidemic might worsen psychological suffering. Some individuals have been struck harder than others by the outbreak's negative effects, with women, lower-income adults, and Black and Hispanic adults among those who have had disproportionate health or financial consequences. Over the course of 2022, Americans' own levels of fear about contracting or transmitting the coronavirus have continued to fall. The coronavirus is one of several possible reasons for stress, such as the economy and concerns about the country's future. Mental health is more essential than ever. It affects all aspects of our life. Everything we do, think, or say is influenced by our mental health. Maintaining healthy mental health and addressing any mental health disorders are critical for restoring constructive behaviors, emotions, and attitudes. Focusing on mental health care may boost productivity, improve our self-image, and strengthen our relationships. Nurturing mental health not only improves our everyday functioning, but it may also help us manage or at least battle some of the physical health issues that are directly related to mental health difficulties. For example, since heart disease and stress are linked, stress management may have a good effect on heart disease. Beyond everything else, mental health has a tremendous influence on our psychological, emotional, and social well-being. It has a direct impact on how we feel and behave on a daily basis when we make tough decisions, cope with stress, and interact with others in our surroundings. Our mental health plays a significant role. However, mental health isn't something we can deal with once and then forget about. It is essential at all stages of our lives. From birth through maturity, mental health is something we must be aware of and treat with caution. We may endeavor to destigmatize how we think about, address, and recognize mental health concerns in our culture by making a concentrated effort to increase mental health awareness. Having those difficult talks and recognizing there is an issue means we can find a solution. We can begin to dispel the guilt and anxiety that are often linked with mental health issues. This increases the possibility of someone reaching out for assistance when they are in need. Asking for assistance is a display of strength. Working together helps us to provide the groundwork for a foundation that recognizes and values the value of healthy mental health. Another advantage of concentrating on mental health awareness is that it might raise awareness of specific illnesses, indications, and symptoms. Early intervention predicts the effectiveness of mental health therapy for many illnesses. The sooner someone is identified and receives therapy, the better their chances of managing their disease and improving their mental health. You should take care of both your physical and mental health if you want to enhance your overall well-being. Get some exercise on a regular basis. Exercise is vital for being physically healthy, but it may also help you feel better. A regular 10-minute stroll will boost your mental awareness, leaving you feeling energized and in a good mood. Consume a healthy diet. A diet rich in fruits and vegetables and low in processed carbohydrates and fats may improve your physical and mental health. Consider hiring a trained nutritionist to assist you in developing a food plan that is tailored to your specific requirements. If you are in a crisis or are having suicide thoughts, you should get treatment right away. Call 911 or the National Suicide Prevention Lifeline at 1-800-273-8255, which is accessible 24 hours a day, 7 days a week. The hotline is a nationwide network of crisis centers located across the United States. They provide free and private emotional help to anybody in need who is undergoing a suicide crisis. Thank you for watching this video on the mental health crisis in America. We hope that it has helped to shed some light on the issue and has given you some insight on how to better support yourself and those around you. Remember, mental health is just as important as physical health, and it's important to take care of both. If you or someone you know is struggling with a mental health issue, please reach out for help. There are many resources available, including hotlines, counseling, and support groups. Remember, you are not alone.